Welcome to the weekly News 13 Coronavirus Virtual Town Hall. I'm George Roberts.
And I'm Marie Johns. Our topic today is the transition of 3 counties in our area this Friday to the yellow phase of Governor Wolf's reopening plan.
Monroe, Pike, and Schuylkill counties join 5 other counties making that move.
Our guests on today's show include Schuylkill County Commissioner George Halcovage, Monroe County Commissioner Sharon Laverdure, and Pike County Commissioner Matt Osterberg. Thank you all for being with us today. We appreciate it. Now, starting with you, George, we know this has been all of you, this has been a long time in coming, but George, Schuylkill County was the first one that we reported on actually putting it out there and asking to turn yellow, wanting to turn yellow, pretty much begging to turn yellow, sending the letters. What are you feeling right now that it's finally coming, and did it come fast enough for you?
It was relief. As commissioners, we have a responsibility to our constituency, and we had set up early on a task force that brought in all the sectors of our county, from the jails to the medical to agriculture, and throughout all of these, our law enforcement, we worked together and we collaborated. We did a lot of good things. And we had boots on the ground. We talked to our hospitals on a daily basis to know where they're at, to our nursing homes. We were ready. And what we were trying to figure out is where we were told we were close, but we weren't hitting the mark. And we just needed to have good communication from the state, because up front, we didn't feel like we had it. And I will tell you that last week, beginning of the week, when the governor and Dr. Levine were on a County Commissioners Association call, and they talked about, I heard the governor say 5 or 6 times the words collaboration and cooperation with county commissioners. We're boots on the ground, and we understand our people as much as anyone. So now our job is to educate people, and instead of, where we did our job in flattening the curve, now we have to flatten the fear.
Okay. Sharon Laverdure, Monroe County. I know last week, if I'm not mistaken, Monroe County thought that they were ready and kind of asking to maybe move into the yellow phase a week early. Why was that?
Well, we thought we were ready, but we were also supportive of our governor and the Secretary of Department of Health. But we wanted them to know that you don't really necessarily have to wait the 10 days once you declare you can go through. That was one of the concerns that we had, and we wanted the governor to know that our businesses and we've already joined with Pocono Promise, which is through the Pocono Mountains Visitors Bureau, to have a plan in place. The minute they were told they could go, we could shift to yellow. And now yellow's not a lot different than red. So we're going to have to educate our folks, just as we talked about, get prepared, but we will be prepared then when it's time to go green, to go green. We're working together with the establishments. We're not in isolation, as George had spoken about.
Mm-hmm. Matt, Pike County, you had the extra challenges of being a bedroom community to New York City and having those people come in at the beginning. How's Pike County doing now? Are you ready, confident, moving into the yellow on Friday?
We're confident in moving ahead into the yellow. We had some struggles with understanding the data as about where we were to meet the thresholds of the 50 per 100,000. And there for a while, Pike County had some really big numbers for a small community. So we were very confused. We're using that as a threshold. We were a little amazed last week when we hear from the Department of Health that wasn't such a really strong indicator to get you open. And yet our information back from them always had been, that's the number you need to attain to. Then we saw some manipulation in the numbers, and I'm not saying it's just they move things around. Some of it was, part of it was some of them I think was misinformation given to Pike County, and some of it was given to Wayne. We're ready though now. We feel our numbers, and you can see the numbers are down. Our businesses are ready. Again, what Sharon said, the Pocono Promise has been a really great tool for our businesses to be prepared. We're working with our businesses now to provide some funding for them to be able to buy some PPE on their own through some community development block grants. And now we're just green with envy to get to the other side.
Love that.
Yeah. Matt, I get the idea, though, after listening to all three of you talk, that communication between the county level and the governor's office was not all that great. Is that true?
Well, I think because this is a new virus, right? We've heard all of that they are learning as they move forward. So I'm not going to sit here and be critical of them, because when we're all done in 6 months from now, we'll have plenty of time to critique this whole thing. Right now, we need to just explain to the Harrisburg what it is that we see in our communities, as George says, the information given out there, whether it was the deaths, whether it was the number of cases, it all seemed to be all over the place at times. And again, I know it's new to them, so I'm not here to be critical on them, but I'm here for them to understand that they need to talk to us more about what's going on. We're still a little concerned, and we've been speaking to them. I just got off the phone before I got on here. We're still concerned with the number of people that are coming through to visit this area and maybe are being tested, and where are those numbers really being attributable to? Because I'll just give you an example. If they come here in their summer home, and there's like 40% of the households in Pike County are second homes, and they don't give the right information as far as their zip code, where does it get added to? So we're still questioning, and again, we know that this is a very difficult process for the Department of Health. This is all new to all of us. We just want people to stay safe. We want to be able to open up, stay safe, and allow these restaurants particularly. I mean, this weekend we'll see gift shops open and that, but it's the restaurants that are really struggling. So I know in our region, we're trying to solicit them to allow for more outdoor dining areas so that these businesses can expand and get themselves open to a further extent than they are now. So we're ready.
So true, and so true. We're lucky we have the space to be able to do that with our restaurants in our more rural areas. They have some space to stretch out, move out. Going back to the previous topic, George, last week you mentioned the meeting last week with the Commissioners Association, and was that we kind of were on the same. It is a very fluid situation. Everybody's learning, but the communication has been. We've been wondering, sitting here, not in your shoes, wondering what's happening and were we missing out on some of the communication that may have been happening that we didn't know about. But when you met with the governor's office last week with the County Commissioners Association, was that the first time that you actually had a meeting with them?
Pretty much. The call was scheduled to be, from my recollection, the call was scheduled to be with the Department of Health. And this was, of course, the day that the couple of days prior to that, we had sent a letter down to the state, basically taking a shot across the bow for all intent and purposes. And it was that, we were going to go yellow. We were ready and able to go yellow. And the purpose of that letter was to really open up the communications. And after we had some situations that happened when the governor made his announcement on Monday, be it as it may, reaction as things happen in tough situations. I don't take anything personally, but the following day to have the governor, Dr. Levine, on this call and to hear about collaboration and cooperation, that's what we've been looking for all along. And I'll agree with Matt and with Sharon. When we're hearing that you're right there, you're right there, you're right there, but you're not across the line, and what you're seeing at boots on the ground level with all of our experts and our leadership in the county, we were confused, and hopefully that started that cooperation, because I thought that I received more information out of that call than we did throughout the whole situation. And understand, there was a lot on their plate. We respect that, but that's where we've always said county government is where the rubber meets the road. We work with our local and municipal officials. We work with our businesses. We work with our chambers. We work with our manufacturers, our nursing homes, our hospitals. County commissioners really never leave their county. So if you want to have a really good idea of what's going on in the county, that's our responsibility as county commissioners. We provide those services, those essential services. that need to be done. And I'm sure you might talk about the election that's coming up on June 2nd. I mean, the challenges of doing an election in this situation are just mind-boggling, but I'm proud of their team here. Everybody's come together. It's Team Schuylkill in our area. It really is. We're lucky.
George, you feel that the governor gave the commissioners enough leeway to do things, or do you think that they really were restricting you over this time period?
Well, again, I felt at one point that we needed to get executive to executive, that we weren't getting some of the information. Having a call with Dr. Levine last week, when we were talking about, where Matt and Sharon will tell you, having that conversation about what metrics are we missing. We don't see it here, but just explain those metrics. And when Dr. Levine says, we're going to have the deep dive done to Schuylkill County's information because you've made some really great points. So we'll have the chief epidemiologist, Dr. Sharon Watkins, do a deep dive with her team, and then we'll get back to you. That was something that, again, there's 67 counties in the state. And I know it's tough to get back to everybody, but we want to see everyone safe. We want to make sure everybody's educated. We want to do the right things for the people in our community. And that's what's most important. We don't want to put anyone in harm's way. But we also, from an economic standpoint, we need to support our small businesses. And I think that we all know that the term shop locally now has much more of a important flavor to it.
Absolutely. Shop locals, definitely. Sharon, moving to you with that, businesses, you'd said yellow's not much different than red, and it's really not, but some things are going to be able to reopen. Those businesses that have been waiting and waiting,
correct.
Are they going to survive? Do you think have you heard of any that are not going to make it through this? Or what is your thought on that in Monroe County?
I have not heard that at this point. We also had a small business loan that we were able to push out through the county, and that money should be going out this week or next week to help $20,000 max, kind of to help over the hurdles here a little bit with our businesses. One of the things I wanted to bring up, if I can go back just a second, was one of the concerns that we had in Monroe County was the tracing that was going on to try to figure out how to contain the virus when we heard, well, there's a breakout here or there's a breakout there. Well, I had called the Department of Health twice to figure out can we have any information on where this is coming from and the tracing. How can we mitigate some of this? And I was not able to get any information on that whatsoever.
Right.
So moving forward, I still think it's important that we have more information about the tracing. We are concerned about, we don't want another go around with this. So making sure that we are still encouraging our residents to mitigate, wear the masks 6 feet apart, being mindful, even as other areas open up, churches open up and things like that. We just need to know more about the tracing, that whole background to that. I don't know, guys, if you have felt that way as well.
I have. In fact, I just got off the phone with them, as I said, with the Department of Health, and that was one of the topics, was the tracing. They mentioned to us that they're looking for large groups to volunteer to trace, and they brought up a Penn State group in this. And when you're in a rural county, it's tough to find large organizations that can do that. But what we did do is we put out numbers of press releases and lots of information telling the citizens to volunteer to go to serve PA. And we know of numbers of people that have made that phone call, but yet those individuals have not been contacted by the state to say, okay, this is what you need to do. So on the phone today, we said, if we're here to help you and you want to communicate with us to reach out to the citizens, somebody from someplace needs to reach back to the people that have volunteered and said, okay, we hear you, here's what we're doing, give us a little time. Again, we know that this is a fluid situation. It's very difficult. It's all new. But, these are the things, as George said, that county commissioners can help them do, and municipal leaders. So we asked them today if they can give us a list of all the individuals that have volunteered as tracers. We'll organize the people, and we'll get them into a Zoom meeting so that they can be trained to help the nurses that are, we each have one county nurse. How much one county nurse can do in this county, I'm not sure. I know that they work with other county nurses in a planned atmosphere, but we still need, they want tracers, we can give them tracers, but they got to get the plan in place. This is no different than the testing. They claim they want to have 2% of the population of each county tested. We have 3 testing sites in Pike County. We know that some of them, one of them, could easily do 5%. But they need to remove the whole thing that you have to go there and with symptoms. Because if they're going to want to test asymptomatic, then they need to remove it.
Matt, aren't you afraid, though, of tracing and testing to the degree that it might uncover that your county should be closed? Doesn't that cross your mind?
Well, it does cross our minds, but that's that's just, we have to be realistic about this whole thing. If we have large amounts of breakouts of this, we need to be aware of it. I hear what you said. We went round and round with that about opening up extra testing sites in Pike County. As I've said other times to all of you, we don't have a hospital, so we need to be dependent upon the Walmart. We need to be dependent upon a local doctor, and now Wayne Hospital with a tent. But I'm not sure being, naive about it and saying, oh, we shouldn't test anybody because we're going to get closed again. Well, I don't know. Would we rather have a bigger breakout in October and shut everything down for 3 months? Again, we have to go for what the professionals are telling us. They're telling us they want to have testing. Tell us as county commissioners how we can do to help you do that. We need to have some free testing because not everybody has insurance. So, not doing the testing, George, I don't know. I mean, ignorance is bliss.
Yeah.
Well, yeah.
Well, how about your senior populations, and especially the senior populations that are in either a nursing home situation, personal care facility, some kind of facility? Do you think we're going to see a shift more of keeping those places locked down and protecting those people more, or what's going on? Let's start with you, George, in Schuylkill County. Are there any places that you're aware of, or what's going to happen with them as the rest of us transition? Are they going to kind of stay protective?
They are. One of the things that we've done, and I'll talk about our task force, we have a call 3 times a week with our nursing home administrators or their directors of nursing. And as I said to them over a period of time, you may be in competition at other times. Right now, it's all team together. And as long as we're working and we're sharing information about what our struggles are, what our good things are, there was questions. We knew of one facility that had a number of positive cases. So I asked the state, okay, have you sent a surge team in? What exactly have you done there? Have you provided the PPE? Have you provided the gowns? Have you provided the face shields? Yeah, let us know how we can participate, because what was happening was they were sending directly, not through our emergency management agency at the county, but the Department of Health was sending directly to them. If we didn't have this Zoom call with them, and I'll tell you what, they are being open, they're being honest, and it's a matter of that we're trying to find best practices. So yeah, there is one facility, and I'll go back to when the chief epidemiologist talked about the struggles. We had 2 nursing homes they were concerned about. The numbers were 6 and below, but they happened early on in this situation. Now, could there be recurrence? Of course there can be, but that's what we need to look at. We need to be able to figure out best practices, and by us being able to bring these people together at a local basis and share our struggles or our strengths or best practices, it's a lesson that I think that we take this beyond this pandemic, but we take it throughout all time and just continue to have that great communication. So the nursing homes, they're our most vulnerable. I know our 3 hospitals, they're ready. They have the facilities, they have the PPE, they have the testing, they have everything going. But I'll go back to the contract tracing. Yeah, we make sure we do that. But the other testing is being done. We want to make sure that it's reliable also. And I know sometimes when you're hearing that there's a 65% reliability, that's of concern. I had a call last week also with the White House. I called our intergovernmental affairs person there and had a great open conversation about how things they're seeing on a national basis and how we are in Pennsylvania. And it was good, positive conversation.
Sharon, you have Pleasant Valley Manor in Snydersville, run by the county.
Yes.
And this, as things started back in March, now you can look back and see, over time how things came about at the manor. Have the commissioners looked into the progress of things that happened at the manor as far as the COVID-19 moving into the facility and how it moved from patient to patient? And of course, you have staff that's there. Have you learned anything over this time?
Oh, absolutely. And more, as we all talked about, putting plans in place and being able to sit down face to face. We talk on a regular basis. Just got done today as well. We did have a surge team in there. We did request that. They came. It was very helpful. We've had support from the National Guard. They've been there as well to help with some of the issues, giving some of our workers a break because they hadn't really had a break, and that's so vitally important. Absolutely, we are working with PBM to make sure. And you talked about they're going to be restricted. They're not going to be open right away. Our correctional facility won't be open right away. Our warden has put into place a gradual opening up, and that's kind of what we're looking at PBM as well. Testing folks that are there, making sure everyone that works there has been tested, and they are. Making sure that our residents are tested, and we are doing that as well to stay ahead of this and not behind it, the whole situation.
All right. Moving on, how about county government? Matt, what's different on the county level as far as moving from red to yellow? Is everybody working from home? Are some people working from home? Are you bringing them back into the offices, into the different county facilities, county offices?
No, except for the courts, the rest of the county is going to continue to operate with the people that we have working out of home, like children, youth caseworkers, and some other departments. It seems to be just fine right now. I know that some of the recommendations under yellow is that if you can continue to work at home, continue to do it. And we just feel that that's an important part. It's really not affecting us. We're going to continue the operations of the county. The offices are only open from 8:30 to 12:30. The courts on Monday will be operating fully, but again, that's the judge's decision, and they're in a separate building anyway. So we're going to continue what we're doing here. We put it out there for at least until we turn green. We just think that that's the right thing to do here, if we can do it, and it's operating just fine. No one seems to be complaining. The work is getting done. We need to do our part to slow down this community spread, if there is such community spread still going on. Back to the testing, there's people aren't being tested, and that's true with our correctional facility. We're still somewhat in a mode of I'll call it lockdown. We had some pretty good cases there. They've all leveled out. Every inmate and detainee in Pike County Correctional Facility has been tested. We're probably going to discuss today about all the staff. We don't happen to own a nursing home, but we are aware of the nursing home here in Milford that had some really tragic circumstances occur with a number of deaths of many, local senior citizens. That it's really horrific that had to happen. But I know the National Guard was in there, and they gave them support. Like my understanding is that's leveled out. So I think we just need to continue in county government to keep the social distancing going on. It's working. We need to be a little bit more patient because, as I said earlier, the last thing we want to see happen is October this come back. This comes back in October and shuts these businesses down again. Then there'll be a lot of them not opening. I haven't heard of any yet that are not reopening, but this happens again over the winter. They'll be really struggling. So
we're getting word, though, Matt, that there are going to be businesses that are not going to make it. And that's going to happen in Pike. It'll happen in Monroe, Carbon, Schuylkill. It's going to happen everywhere. The thing is, though, with all these businesses that won't make it, people out of work right now, and that's going to continue. How is that going to affect the budget at the county level?
On Pike County's budget, our budget has already been affected because we have such a strong relationship with ICE. And that population has drastically been reduced because we needed to move people out of the correctional facility. So that's really the impact that we're going to see in the county government, is that income. Our revenue source has really slowed down a lot. It's a process that was going on. I think the relationship with ICE has been going on for 25 years. So it's not like it's anything new. We'll rebuild that back up when we feel that it's safe to have people re-enter the correctional facility. As far as the businesses closing, that's going to hurt in some areas with earned income taxes. Only a few municipalities in Pike County have an earned income tax. I know other counties rely on that much more. The county side of it, our only income level is real estate taxes. So, having people on unemployment will probably slow them down in paying their home taxes and that. But that's our only resources.
Mm-hmm. Same question going to you, George, on Schuylkill County government, anything changing, as we move into the yellow, same thing, with what's going to happen in your offices?
There's so much that's involved, and it's been team throughout the whole situation. Do we know that we're going to have struggles? Absolutely, we know we're going to have the struggles. Who would have ever thought we'd be doing Zoom calls all the time? I mean, we're zoomed out, but it's okay. Yeah. But you just that's a big item.
Sure.
But it works, and what happens is we make it work because we have to, and that's what my fellow county commissioners are on this call. My fellow county commissioners here. That's what we've been elected to do. We're not politicians. We're public servants. We're there to serve the public. We represent the public, and as long as we keep focus on that, to provide those services, we're in a good place.
All right. Sharon, last word. How do you feel about moving into yellow on Friday?
Oh, we're very excited about it. The one thing that we're looking forward to in the future, because it's not going to happen on Friday, we're getting our resorts and our hotels back in business. When you talked about some of the county impact, we will be feeling it down the road. A couple quarters down the road when our hotel tax money is not coming in due to folks not being able to be there. So we're watching that very carefully, but we understand, as George has said, we understand how we have to work together and that to make this move forward safely. And I think that's the message. We still need to work together, move forward safely, mitigate, be aware that and the role that each individual plays. And I think we talk about hometown heroes. I think every single person that's done that up to this point they're my heroes as well. Essential workers, I agree. It's amazing how everybody has pulled together to be there. Even those that are working from home are doing an outstanding job as well. Telework is going to stay. It's not going to go away right now. So very those folks are still working very hard at home.
Yeah, very, very true. Well, yellow on Friday. We hope green is not too far out beyond that. Thanks to all three of you for joining us today. Schuylkill County Commissioner George Halcovage, Monroe County Commissioner Sharon Laverdure, and Pike County Commissioner Matt Osterberg. Thank you.
Thank you very much.
Thank you. Stay safe.
Thank you. Thank you for the opportunity. Everyone be safe. Be well.
George, Sharon, bye-bye.
Don't forget, for the latest local coronavirus information, watch News 13's Pocono Valley and Night Reports, only on cable.